Senator Lujan.
Thank you, Mr. Chairman. Secretary Kennedy, Dr. Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr. Daskalakis.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed by all the time by CDC.
Just a name.
Dr. William Thompson's one name.
Thank you very much, sir.
Now, but I can get you a whole list of other. It's on my schedule.
Mr. Secretary, that's not a hard question. You know a lot of answers.
I'm not being evasive.
Okay, then you answered it. Let's go on. Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed unsurprisingly with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children. So I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a contractor.
Do you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what the...
I'm going to pull up the website for you.
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee
Well, I don't
that you
know
were
if
wrong?
a contractor can be classified as a senior data analyst or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board. He sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible, Mr. Kennedy.
Senator, you're ridiculous.
So here's the question I have. You brought him in to do this study. I think there's no question about it.
I told you he's not doing a study.
Is he participating in the study?
No. What
is he doing any analysis in regards to this study?
No. What he's doing is getting access to the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months. For
Mr.
7 months.
Secretary, let me ask you this question, just because you know the answer. What is Mr. Geyer doing?
He is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC will not give us, they have
Mr. Secretary, is he participating in this then?
No.
But you just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you just want to show? Do you just want to showboat?
I'll submit.
You just want to showboat for your ads, or do you want to hear a real answer to your question?
Mr. Secretary, you choose to know answers to questions with some colleagues. And
I'm willing to give you the answer. I'm willing to give you the answer.
Mr. Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move on.
I don't even know what you're talking about. You're talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
And then give me a chance to answer.
Does this help? Can you understand me?
Yes.
Appreciate that. Mr. Secretary, yes or no, did you hire Mr. Geyer to do this study?
No.
Mr. Chairman, well, let me ask, maybe we'll just get a good answer here. Mr. Secretary, will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this committee by the end of the week?
No, not because that's not the way it works.
Will you
don't even know what you're talking about.
Mr. Secretary, will you commit to sharing the protocols for this study by the end of the month?
We already have
You just said it's public.
We put out the notice of funding opportunities, and then the scientists from all over the world.
You're not understanding me. Let me speak
No, you're
clearly
not
again.
understanding how the world works.
Do you understand what the protocols are?
Senator-
Do you understand what they are?
The scientists who are doing the studies submit the protocol.
Okay, so you know
That's
what
not
they
coming
are.
from
Okay,
us.
so will you commit to sharing those protocols with this committee?
Well, anybody can get a hold of the protocol. It's published with the study.
Mr. Chairman, what I'd like to ask is for your commitment here. I'll send a letter to the secretary. I'll ask for support from the leadership of this committee to ask for those protocols. If those protocols are not given to this
Anybody
committee,
can get the protocols.
Mr. Secretary, I'm not talking to you. Mr. Chairman, what I'm
If the
asking,
protocols are public, we can work with you to
what I'm
get
asking,
access to-
Mr. Chairman, is that if those protocols are not given to this committee, I'm asking for your agreement that we follow through with the subpoena to get them.
No, I will not agree to subpoena anything. Let's see what
But Mr.
happens.
Chairman, you'll help me get them if they're available publicly?
Yes.
I appreciate that, Mr. Chairman. Mr. Kennedy, with all the questions here today, people just want to know the truth. When,
I don't think so.
Mr. Secretary, you don't think so? Thank you.
I don't think so.
I hope everyone recording that got that, because there explains the Secretary's tenure here. Look, two young ladies in Las Cruces, New Mexico, at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it, because what this represents is to remember that every one of us can make a difference, sir, to something as small as a starfish on a beach that maybe got washed up, you throw it back in the ocean. You might not save them all, but you can save one. I'm sorry that you're not worthy of this. Nice little pin, sir, is a nice reminder. I'm going to pray for you, Secretary Kennedy. I hope we do better. I want you to do better. But today was a failure for you, man. I yield back.
Senator.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped, I didn't support you. I thought taking on chronic illnesses was going to be important. I've got two kids, as we discussed when you met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that, because there was so much data chaos coming out of the CDC, and there
So
were
I'll
so
take
many perverse
sir,
incentives, and these are
you don't know
modeling
you don't know the
studies.
answer of how many Americans
Oh,
died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data. I'm
You
not
have had this
completely-
job for 8 months, and you don't know the data about whether the vaccine
No,
saved
and that's
lives?
the problem, is that they didn't have the data. The data by the Biden administration, absolutely dismal. It was data chaos.
Who is politicizing? You're saying the Biden administration politicized all the data? Go back to what
Yeah.
Senator Cantwell just
They
said.
fired Dr.
Go to
Krause.
the Trump Surgeon General.
They fired Dr. Krause. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krause,
So,
Martin
Mr. Chairman, the
Kilgore.
Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you got to one, I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then, how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there is not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice.
That's the problem with our thing.
And obviously, Tom Cotton's going to, who knows who he's going to trust.